In Chinese medicine, we talk about something called qi.
Va a hablar de algo que se llama chi.
And we pronounce it write it C-H-I or Q-I.
C-H-I o Q-I.
And qi is oxygen and energy.
Es oxígeno y energía.
And do you think we need oxygen and energy for our body to work?
Que si tú piensas que necesitamos oxígeno para el cuerpo.
Sí, el cuerpo sí necesita oxígeno.
Yeah, it's very necessary, right? And so when we're breathing, our lungs take in the oxygen.
Cuando estás respirando, los pulmones toman oxígeno.
Yeah, and so the oxygen is also carried by the blood.
Y también la sangre mueve el oxígeno.
So that's what this arrow here. This arrow means that oxygen is carried by the blood.
Eso es lo que dice ahí.
And so so it is a liquid, right? It's a liquid. It has cells inside of it.
Mm-hmm.
It has water. It has hormones.
Tiene agua, hormonas.
And oxygen.
Oxígeno.
And so it starts in the heart and it goes to the lungs.
Empieza en el corazón y llega hasta los pulmones.
Then it goes back to the heart.
Y luego regresa al corazón.
Then it's pumped out to all parts of the body, the legs, the arms, the fingertips, the toes,
alcanza los brazos y las piernas.
Yep. And to the brain. And then the cells take the nutrients like the proteins and the carbohydrates and the fats into the cell, so it has the nutrients from the blood.
Hay nutrientes que el cuerpo usa de la sangre.
En la sangre.
Sí.
Okay.
And then the cells also have toxins, so they throw their toxins into the blood.
También hay toxinas que también están en la sangre para quitarlo del cuerpo.
And so so then the blood comes back through the veins. It goes out through the arteries, and the arterial blood is bright red because it's more oxygenated.
Y se mueve en las venas y los órganos también.
Yeah, arterioles.
Arteries.
On the way out
Arteries.
is the arteries.
Arteries.
And going back is the veins.
Right.
So the blood coming back through the veins is filtered by the liver, it's filtered by the kidneys, it's filtered by the spleen, and it goes past the small intestine to absorb nutrients.
Mueve en la hígado, los riñones, los intestinos, and
In the spleen.
the spleen. I don't know how to say
Okay. And so that's where it's filtered. So the toxins are filtered by the liver, by the kidneys.
Toxins.
Then it goes back to the heart.
Y luego regresa al corazón, ya que está limpio.
So we talk about qi and we talk about blood. And then the blood also, here, this arrow here, is showing that the blood is flowing through the organs.
Que la sangre mueve en los órganos.
So what are some examples of organs we talked about?
El kidney es los riñones, ¿verdad?
Riñones.
Yes. And then it also flows in what we call the CNS, which is central nervous system.
Okay.
The blood and oxygen.
Los nervios.
All right, so we were talking about the qi and the blood flowing to the organs and to the central nervous system.
Y también se mueve en el centro de nervios, el sistema de nervios.
And the central nervous system is composed of two primary things.
En los nervios hay dos cosas.
There's the brain
El cerebro
and the spinal cord.
y el columna vertebral.
And the brain and the spinal cord also have to have oxygen and blood to work right.
Y eso también necesita oxígeno y sangre.
Surrounding the brain and the spinal cord, there are three thin membranes.
Hay tres
membranos, maybe.
Membranas, así se dice.
And they are like saran wrap or plastic wrap.
Son como papel plástico, muy
Like that you sandwich wrap that you put around sandwiches and
muy
things.
Ziploc.
And between two of those membranes, the blood flows.
entre dos de esos corre la sangre.
And between the other two layers is the cerebrospinal fluid. It's a special liquid that flows only in the brain and the spinal cord.
Y hay un líquido que es
Cerebrospinal, I don't know what it is.
okay, otro líquido que se mueve por ahí.
And those membranes, if they get twisted or stretched, then the flow starts to be decreased.
Okay. Si algo está pasando en esos espacios, como no sé, algo. What happens?
The blood gets blocked,
El sangre se está atorado.
and so the brain or the nerves don't get all the nutrition and the oxygen that it
Entonces el
needs.
cerebro y los nervios no pueden tomar el sangre o el oxígeno que necesitan.
And those membranes surround the nerves, sort of like if you had something wrapped around it. Usually it's not so tight, so if the nerves are moving in it, then it doesn't cause friction.
Okay.
So they actually, the membranes go around the nerves.
Mhm.
And then the blood is flowing inside those membranes. And then it gradually goes into the nerves to feed the nerves. But if it gets, if there's an injury, sometimes it gets tight on the nerve, and then it causes the nerve to shoot.
Cuando estás lastimado, sorry, what shoots?
So the nerve starts firing.
Okay, los nervios empiezan a mandar mensajes
And some of those sensations are pain
y a
sensations.
veces hay dolor por eso.
And so sometimes the pain is because the membrane is too tight, causing a stimulation of the nerve and then causing a pain.
Si el
Feeling.
membrano está cortando algo, no está llegando y duele.
Does that make sense? Okay. So we have to have enough oxygen. We have to have enough blood of good quality flowing to the organs and the central nervous system for our body to function properly.
Entonces necesitas mucho oxígeno, sangre para moverlo en los órganos y los nervios para que el cuerpo está trabajando.
So when all of this is working right,
Cuando todo está trabajando bien,
then the body gets the oxygen from the chi,
el cuerpo puede recibir el chi o el oxígeno.
and the body gets the nutrients from the blood, like proteins, carbohydrates, fats, the things from our food.
Nutrientes.
Are you okay?
Yeah.
And then the organs also make things like hormones.
Y hormonas también.
There are various hormones. There's the testosterone, there's the estrogen, there's the cortisol, which is related to stress reactions, and other kinds of hormones.
Okay. Testosterone. There's a few of these words I'm not really good at saying, but
Estrogen, you know estrogen?
no, I don't.
Estrogen, maybe. Okay. And then the central nervous system sends the messages to the body,
Y los nervios empiezan a mandar mensajes al cuerpo
and it controls the actions of the
y
body.
puede controlar.
¿Testosterona es líquido, es aire o es oxígeno?
Es un hormona. Is it liquid or?
The hormones?
It's, yeah.
The hormones are chemicals
Oh.
that go into the bloodstream, and then they affect the different organs.
Okay. It's un chemical que llega.
It's like a nutrient, like if you eat some food, it's solid and liquid. The hormones are also depending. It's put in the bloodstream, and so it's a solid chemical, but it goes around and it has action.
Entonces no es líquido. Dice que es.
But it's carried by liquid.
Pero sí mueve con líquido.
So, like sometimes people get a cortisone shot. Cortisone. You heard of cortisone?
Le dan una inyección de cortisone.
And cortisone is like a natural. It's an artificial hormone.
Es una hormona artificial.
But in our body we have cortisol,
Pero en el cuerpo hay otra hormona que se llama cortisol.
and the cortisol is like cortisone,
Y es
but
igual.
cortisol
pero-
is natural.
Pero cortisol
and
es
cortisone
natural.
is artificial.
Y cortisol no es natural.
And so, if someone has pain, sometimes they will inject cortisone to reduce the pain and
Si alguien
inflammation.
tiene dolor en el cuerpo,
I can't remember if maybe you have that or not.
Ya he dejado one. Agarré una inyección.
dijeron,
Ya.
Yeah.
Agarré una inyección.
Yeah. And so it's put into a liquid so that it can be injected. But it's like sugar. Is sugar liquid?
el azúcar es líquido.
Oh,
It's crystals, right?
Es un cristal.
nunca vi eso. Vi que me inyectaron, pero nunca vi.
Que no es un líquido, pero lo ponen con líquido cuando lo
Mm,
ponen en el
right.
cuerpo.
Oh.
Yeah, so it's dissolved in the liquid. So when all this is working right, we say we have 100% function.
Cuando todo está trabajando, dicen que tienes 100% en el cuerpo.
And 100% function is our definition of health.
Y
here.
eso es lo que él piensa es el salud, cuando todo está trabajando 100%.
And when we have 100% function, it is easy to do things.
Y también es más fácil hacer las cosas que quieres cuando todo está trabajando.
Eso sí es claro. Si cuando todo está trabajando bien,
Sí,
no necesitaba estar aquí
sí.
para que...
Does that make
He
sense?
agrees, yeah.
So ease means you move around and there's no pain.
Explíquele que como si todo estuviera bien, no necesitaba estar aquí con él.
That if
para
he
que-
was, everything was fine, he wouldn't need to.
Exactly.
Exactly.
So 100% function means like you digest food and you have no problem. You eat food, no problem.
Cuando todo está trabajando, no tienes problema con la comida, todo se siente bien.
When you move, there's no pain and no restriction in
No hay
movement. That's
dolor.
100% function.
Y no hay dolor en el cuerpo.
And you remember things when you want to remember them.
Y en la mente puedes acordar de cosas fácil.
That's 100% function.
Eso es 100%.
When we have some kind of a blockage in the flow of blood and oxygen,
Cuando hay algo que está tapando uno de los sistemas,
let's say something was wrapped around my finger like this, tight.
si había algo
Then the finger is going to change colors.
cortando el
It's going to become purple and maybe green and yellow and then black,
y negro,
and then it will die,
y luego se va a morir.
right? Because there's no blood and oxygen getting
Porque
to
no
it.
hay sangre ni oxígeno.
And so the flow of blood and oxygen is very important for things to function
El
properly.
movimiento del sangre y oxígeno es importante para todo lo que trabaja.
Y si eso pasase, lo que está diciendo del organismo, lo que está apretando ahí, ¿qué necesita para que eso comience a...
So he's asking when something's tight around it, what does it need for it to...
Exactly. So that we call that stagnation.
So
When the blood and oxygen is not flowing properly, it's stagnation. And there's
what
various
is it-
reasons, so I'll
What
explain
does
that.
it need to
Yeah.
get better? Yes.
So sometimes the muscles are too tight
A veces los músculos están apretados
because there's like a shock or like it's jolted like that and the muscles get very tight because it's trying to protect the body.
que hace eso cuando está protegiendo el cuerpo
And so we have to slowly get those muscles to relax more.
y tienes que empezar a relajar los músculos para que
And there's
ya no
also
está apretado.
and there's also the meninges, which are the membranes that surround the brain.
Okay.
Meninges, MENINGES.
Hay otros pues nervios que están
That
por
are
el
here.
cerebro
That can get very tight
que
and
también
irritate the
se
nerve,
pueden
and that can cause pain too.
atorar y causa dolor.
So that's different from just the blood flow.
Y eso es diferente de que el sangre.
So trauma, like an accident, can cause this kind of stagnation.
Un accidente puede causar eso, que ya no está moviendo las cosas bien.
The stagnation stops the oxygen from getting to the body or the
Y
muscles.
eso para el oxígeno.
And the stagnation stops the nutrients from getting to the blood.
Y también los nutrientes
body.
a llegar al cuerpo
And the hormones are disrupted,
y los hormonas.
so we don't get the hormones that are necessary for the muscles to work right, for example. And then the central nervous system, the messages are also blocked.
Y los mensajes de los nervios también se pueden
So it's
atorar.
several different things that can happen with an injury.
Hay varias cosas que pueden pasar cuando te lastimas que van a afectar el cuerpo.
So,
diferente.
So when we start at 100%, then we get stagnation. The function starts to go down.
So, empiezas con 100%, pero hay algo atorado o algo que te lastimaste y empiezas a bajar de salud.
So when we lose 20% of function because of stagnation, we start having dysfunction of organs.
Cuando pierdes 20,
So we start out with 100%, and then we get a stagnation because of stress, because of trauma,
el estrés o el accidente
or toxicity.
puede afectar el función en el cuerpo.
Any of those things can cause the stagnation. And then the function decreases, so we lose 20% of function because of this. We start having dysfunction or malfunction of organs and muscles.
Cuando pierdes 20%, empiezas a el función en el cuerpo se está bajando.
When we do not take care of the stagnation,
Cuando no estás tratando la problema en el cuerpo,
then the function keeps going down farther.
empieza a
We have-
bajar más y más el función.
More degeneration. And at 60% we have disease.
Y luego
dis-ease.
empiezas a tener como más problemas con el salud.
If we don't deal with all the stagnation, the body continues, the function goes down.
Y si no estás trabajando en esas áreas, se va a bajar más y más y el cuerpo.
And so when we've lost 60%, we have 40% function left. We start having symptoms.
Cuando hay nomás 40%, empiezas a notar cosas en el cuerpo como síntomas.
So symptoms are like pain in the hand,
Dolor en el mano,
pain in the
el
elbow,
codo,
pain in the shoulder,
el hombro.
pain in the neck. That's what
Cuello.
symptoms are.
Esos son síntomas.
Pero eso sí cambia natural, ¿verdad?
¿Cómo?
Eso sí viene natural.
¿Los síntomas?
Eso sí es natural, de que uno se le agarra dolor en los brazos, en los
Sí,
codos.
sí. He's just saying that's natural.
It is a natural consequence of some kind of
Es
stagnation.
algo natural que cuando algo está atorado en el cuerpo,
Because before the accident, he didn't have that.
porque antes del accidente no tenías síntomas.
Ah, ok. Está relacionado con accidente.
It's related to the
Exactly.
accident.
The accident caused the stagnation, which
El
caused this
accidente
pain.
causó todo eso.
Sometimes it's a very slow
Y a
process.
veces no se nota, se toma tiempo para notar los problemas.
Sometimes the decrease in function takes years.
Y a veces puede tomar años para notar que el cuerpo no está trabajando.
But other times, just like that.
Pero otras veces puedes
Like an
notar,
accident can happen, bam, like that, and then you have pain immediately.
a veces con un accidente
Right.
te pega
So-
más rápido.
This can be very slow or very quick.
Puede
And
ser rápido o muy lento.
in your situation, it's very, very fast.
En tu situación se pasó muy rápido.
So when someone has symptoms, it means they're at 40% functioning in that
Cuando
particular
alguien
area.
tiene síntomas, dice que estás en 40% del salud.
So again, these are three reasons why the stagnation occurs. Trauma, or
Un
accident,
trauma, un accidente,
or stress,
estrés,
and toxicity.
toxicidad.
Like poisons in the environment or pesticide exposure.
Como si hay veneno en el aire o algo químicos que no son naturales.
And then some examples of, so this is overall, the stagnation leads to blockage and a decrease in function.
Sorry, start it over. The what?
So the trauma,
So cuando hay un accidente,
the
estrés
stress,
o veneno,
this trauma, stress, and toxicity leads to the blockages in the flow
eso
of
va a
oxygen,
causar
stagnation,
algo que está tapado, que no está trabajando en el cuerpo
and then a decrease in the function.
y el funcionamiento